briefing. Um, Today we'll have Dr. Alice Jahangir, Chair of Metro's Coronavirus Task Force and Chair of the Metropolitan Board of Health, and Dr. Joanna Shaw-KaiKai, Associate Medical Director of Communicable Disease Control for the Metro Public Health Department. And we'll have Hugh Atkins will be available to answer your questions. We'll start now with Dr. Jahangir.
Good morning, everyone. Here's the latest on coronavirus in Davidson County. Our active case count today is 1,795, down from 1,867 last week. Total cases today from the beginning of the pandemic are 95,499, up 193 from yesterday, and our 7-day average of percent positive is 4.6%. Rolling average is steady at 135, and our 7-day average per 100,000 is also steady at 19.1, with a transmission rate of 0.97. Hospitalizations in Middle Tennessee is 317, which is just one more than last week, and Davidson County hospitalizations are 188, again, 2 less than last week. 18 people have died from COVID-19 since the last update, so now 889 Nashvillians have passed away because of COVID-19. So far, 220,182 Nashvillians have received at least one dose of the vaccine. So that's close to 32% of our residents in our city have received at least one dose. And 127,700 residents are considered fully vaccinated. So about 18% of our county. As I mentioned deaths earlier, should point out that 91% of our deaths have been in people over 55 years old. So as you look at those who are over 55 who have been vaccinated, 59% of Nashvillians over 55 have now been vaccinated. Of that group, 51% of whites over 55, 43% of blacks over 55, and 41% of people of Hispanic ethnicity over 55 have received the vaccine. So this is a good start that I'd like to continue in order to minimize mortality. Now, as all of you know, we are vaccinating anyone over 16 now, and we're working very hard to meet Mayor Cooper's goal of having 50% of Nashvillians vaccinated by May. We've had a great response to our vaccination site at Music City Center, and we'll continue to make more appointments available weekly at this site for the Pfizer vaccine. And as you saw yesterday, we announced that the COVID-19 assessment site at former Kmart, located at 2491 Murfreesboro Road, is transitioning to a COVID vaccination drive-through site, offering the one-dose Johnson & Johnson vaccine. Now, this drive-through site will open Monday, April 12th, and will be offered from 8 a.m. to 2 p.m. Monday through Fridays. This will be by appointment only, and it's only available to those who are 18 years and older, as that is what the Johnson & Johnson vaccine has been approved for. Registration for this drive-through location will begin today at 10 a.m. The drive-through location will begin with a total of 300 slots each day for 1,500 slots a week. And this is in addition to the vaccines clinic slots that are available at the Music City Center. The clinic at Music City Center, as noted, will continue to offer the 2-dose vaccine from Pfizer, which is approved for those 16 and over. So 16 and 17-year-olds should register for the Music City Center. Additionally, the remaining 2 community assessment centers at Nissan Stadium and Meharry Medical College will continue providing free COVID-19 tests, and hours of operation starting Monday for those locations will be 8 a.m. to 2 p.m. Now, appointments for all of our city sites can be made by going to covid19.nashville.gov or calling 615-862-7777. Appointments will be made available each Thursday for the upcoming week's slots at the Kmart site, and appointments for the next block of appointments at Music City Center will be made available each Friday. So if you have any problems getting an appointment, check back Thursdays and Fridays for new location. And as always, I want to remind everyone in Davidson County that vaccines are available all over our community now, from health systems to clinics, such as Neighborhood Health, Matthew Walker, Siloam Health, Meharry Medical College, pharmacies in Walmart, Publix, Kroger. Each has their own registration. And there are many other opportunities in our area. So please go to vaccinefinder.org to find other vaccination opportunities. As you can see, we're making great progress. We really are shooting for the mayor's goal of 50 by 5. And I really think we're on the right track. And thank you for continuing to do your part. And I look forward to questions. I now would like to turn over to Dr. Shaw-KaiKai. Thank you.
Good morning, everyone. Good morning, Nashville. On behalf of the Mayor's Communities of Color Initiative and the Metro Health Department Underserved Communities teams, I would like to give you an update of our efforts. We had an awesome Spanish language COVID-19 vaccine educational town hall last night. Thank you to our panelists. April the 1st through April the 6th, the Health Department's mobile vaccination team, also known as the Strike Team, administered 1,972 doses of the COVID-19 vaccine. This includes first and second doses. As always, we are grateful to the Tennessee Department of Health for the vaccine supplies, our partners, and the Mayor's Office for the support. Today, we would like to give a shout out to some of the council members who have come to outreach events. Council members at large, Sharon Hurt, Council member at large, Zofat Sura, Council member Brandon Taylor, and Jennifer Gamble. Also, the Strike Team would like to thank Sabina Mohideen of American Muslim Advisory Council, Omaran Lee from the Congressional Health and Education Network, also known as CHEN, and Stephen Neelums at Metro Parks, who have never gotten tired of all our questions and helping us out. Continuing with the good news, as Dr. Jahangir had said, we'll continue to expand vaccination outreach. You might be aware that the Metro Health Department, Neighborhood Health, St. Thomas Health, and 16 other organizations, including Metro Social Services, have launched an initiative in Nashville to remove any barriers for persons who are experiencing homelessness to receive a COVID-19 vaccine. In other words, 100% access to the COVID-19 vaccines by Memorial Day. The vaccine administered will be the Johnson & Johnson vaccine. And good news, pre-registration is not required for these events at the downtown clinic or outreach events for persons experiencing homelessness. Last but not least, this is Public Health Week. We would like to say thank you to all public health professionals. Thank you. I'll turn it back over to Dr. Jahangir.
All right, colleagues, thank you. Thank you, Dr. Shaw-KaiKai. All right, we'll open up to questions. I see Blake Farmer's hand is up. So Blake.
Thanks. The fatality numbers seem kind of high, and I know they're not linked to deaths that happened, in the last couple of days necessarily. But I mean, what's going on there? Is there still kind of a backup with the medical examiner, or is it indicating that we are still having a high level of fatalities, which wouldn't make a whole lot of sense? But can you all talk a little bit about that?
Yeah, so what I don't have in front of me is the date of the deaths reported, as you highlighted. If it's all right, let us circle back with you.
Okay.
And get you. I just don't have that data in front of me to see if those 18 deaths over this past week, if when they were registered. So
wait, were those 18 in the last? I thought it was 18 since the last report yesterday.
That's right.
You're not saying 8?
No. I mean, since my last report a week ago. I'm sorry.
Okay. Well, either way, it does seem like fatalities are not sort of dropping off the way you might think, considering so many vulnerable people have been vaccinated. Is at least sort of more broadly, is there concern that the fatalities are not dropping off in the way that the city would expect?
I actually maybe disagree with you a little bit. I think fatalities have decreased a fair amount, both here and in the state, as far as the rate we were seeing. because and because of people who are being impacted now are younger. But let us look. I don't want to give you the wrong information. Let me look into the epidemiology of that, and we'll make sure we follow up with you. But I actually don't think the mortality rate is by any means as bad as we were seeing December, January, and February. But I'll get back to you. Thank you. Chris Davis.
Good morning, Dr. Jahangir. I was wondering if you could talk about the selection of the Kmart site for the vaccination center. And does that have to do with Antioch area being really a hotspot during the throes of the pandemic?
Yeah, so I think there's two reasons that we chose the Kmart location for this drive-through. One is we want to be able. I don't think it was not coincidental that we did choose to be an area where there are more new Americans, new people of Hispanic, or more people of Hispanic ethnicity, so we can give access to those populations. Number one. Number two, that was one of the three testing sites, the one location that was not being utilized as often as Nissan or Meharry Medical College. So access to testing is still going to be pretty robust in the city, and by using that location, it will allow us to do that. I will also say we actually are partnering with Connection America to help us register some people for that site who are Spanish speaking and other new Americans also. So.
And if I can, just a quick follow up. How do you feel like the city's overall effort to vaccinate new Americans is going?
I think it's going well. As I mentioned, 41% of those over 55 or who are of Hispanic ethnicity is a good number. I think what Dr. Shaw-KaiKai was referring to earlier, some of the efforts, whether it's through mosques to community centers, those are helping. I think they're going fairly well. Obviously, we want to give access to everyone who wants the vaccine. We want to make sure everyone's educated appropriately, and using leaders within those communities to help is really critical. But I think overall we are doing fairly well in those communities.
Thank you.
Thank you, Chris. Vivian Jones.
Good morning. Thank you so much for this update. I wondered if you could share a few more details about the outreach to the homeless community. Is there a number of how many people experiencing homelessness that have been vaccinated so far?
Sure. Hold on one second. I'm going to turn it over.
Good morning again. We don't have that exact number at this time, but we can look into that and for a follow-up. But we know that even prior to this, the health department and our partners have been out offering vaccines to those experiencing homelessness. So we've gotten quite a good number of people vaccinated.
What exactly are you all going out to, like, where there are known encampments, or is there a clinic where they go, or how does that work?
So with this initiative, we will be going out to encampments, and also they'll be receiving services through our neighborhood health downtown clinic. And again, no pre-registration is required. So we're trying to remove all barriers to make sure that we're getting them vaccinated.
Hey, Vivian, this is Brian. Did you get the news release that we sent out a couple of days ago about how we're working with Neighborhood Health, St. Thomas Health? There are like 16 others that are working in the community to not only educate, but also to provide the vaccines that Dr. Shaw-KaiKai was just giving you.
Yes, sir. Thank you.
Okay,
Yeah.
great. I just want to make sure you got that.
Yeah, and some of those other locations will be Centennial Park, Green Street Church, and many other locations.
So the uptake has been good.
Yes, very much so.
Thank you.
Thank you.
And then I don't see any other hand. Oh, no. Yeun Zhang from the Tennessean. Go ahead with your question.
Good morning. With 32% of Davidson County now with their first dose, does that mean the city is moving on to the next level of rolling back some restrictions?
Yes, as we had mentioned a few weeks ago, 20% and 30% will be our markers. My colleagues here at the health department are working on, and the mayor's office working on the reopening, refining the order, and an updated order will come next week. Again, if you remember, we always say when we hit the metric, we're going to spend the next 7 days evaluating the situation on the ground, if you will, to make sure there's nothing abnormal. And thus far, cases have remained stable, hospitalizations have remained stable, and so we anticipate early next week we'll further issue a new order that will roll back some of the reopening metrics.
And just to clarify, so I know you said that there's maybe a week period where you kind of review that, but you think at this point, you're confident that it would be sometime early next week?
Pretty confident, yep.
Okay. And my last question is, I'm wondering about variants, if we're seeing some of that increase here in Nashville, any concerns about more cases reported with children under 16?
That is something that we are watching thus far. I mean, it has not seemed to pan out, and as I noted, our cases have remained stable, so we're not seeing an increased incidence of cases, increased incidence of hospitalizations. But I'll say personally, I'm very much concerned about the variants and what you're seeing at other places around the United States. That does not appear to be impacting us here locally at this point. But again, that's part of the things that we look at whenever we just talked about, like looking at the situation on the ground. Thus far, we're not seeing that here in Nashville.
Thank you.
Thank you.
And our next question is from Hannah McDonald at Channel 5. Go ahead, Hannah.
Hey, good morning. That previous answer helped a bit with what I was going to ask. And it was simply if anything was being done in Metro to get 16, 17, 18-year-olds, that age group, signing up to get their vaccine. If anything, specifically happening with the younger population. And I was going to frame it around the variants it looks like in other parts of the country are definitely affecting that young group.
Yeah, there's no direct initiative such as the ones we've mentioned earlier around, for example, minority populations, immigrant populations, those experiencing homelessness that we're doing around 16 and 17-year-olds. My recommendation is to all parents to really think through this. To maybe perhaps schools would like to encourage their 16 and 17-year-old students to get vaccinated, but there's no Metro Public Health initiative directed at that. And we are seeing, I'm sorry, we are seeing people, parents bringing 16, 17-year-olds in. So we are seeing an uptick in those individuals now that we've been open for about a week or so for people who are 16 or above.
And our last question I got by text is from Alexandria at Adams at Channel 4. She has a couple of questions. How many people will you be able to serve daily at the drive-through site? That's the first question. The second question is about the outreach to the hospitality workers. Restaurant and bar workers are some of the most at risk, and we have reserved extra doses of vaccine for them. Is there a special registration page? I'll answer those two questions, Alexandria. The first question, we're hoping to see about 300 a day at the former Kmart site. And there is a link for hospitality workers, and they have been signing up, although I don't know how many have been signed up. And then I think your third question we covered earlier, and that was about how we are outreach to the homeless. So, and I'm going to check and see if there are any other hands up. Vivian or Yoon, your hands are still up. Do you have any follow-up questions? No. Okay. Well, I think that's all the questions we have for today. Thanks everyone for being here. Our next briefing will be at 9:30 on Thursday, April 15th. And we will conclude today's conference and see you next week. Thanks.
Thank you. And Brett, we'll get you, or I'm sorry, Blake, we'll get you that answer. All right. Thanks, man. Bye-bye.